Up one day quite by accident. We were speaking at a tea party in Plymouth, Michigan, and I'm up here bragging about the fact that I don't own a red tie and a blue coat and a white shirt, and I look over and here's a guy wearing one, and I thought, oh man, I'm really sorry. Well, it turns out it's Dr. David Janda, one of the foremost experts on the healthcare situation we're going to find ourselves in about 2014. This man is jaw-dropping to listen to, so let's get him up here and let him speak. Here's Dr. David Janda.
Thank you very much, Theron. First couple things. It's interesting, a couple of our meetings with Theron. You know, he has a great show. He's been described as the next Rush Limbaugh, and he truly is. I mean, he's even more analytical than Rush, and he's really has a great show. So if you haven't listened to On the Edge, please do, because you will really come away better educated and more informed about what we're all facing in this country on a daily basis. And you know, when you listen to his show, he talks about always eating pork and this and that. Well, I'm going to be starting a show on Wham! Operation Freedom actually premieres on Halloween. So if Halloween wasn't scary enough, I'm doing some commentaries called Americans' Vital Signs. So I was out, one of the first times I got to Wham! Radio, I was out in the parking lot and I noticed they had about 1 billion birds in the parking lot. I mean, it was like the movie The Birds with Hitchcock. And I'm trying to figure out, how do they have all these birds there? So Theron's always talking about eating pork and all this kind of great stuff, you know? So I stood out in the car one of the next times I came back, and I saw Theron coming out, and he's always talking about these people who eat crustless sandwiches and bean sprouts and all this kind of stuff, and not real men and stuff. And I see Theron come out with this bag, and all of a sudden all these birds come down around him, and he has crust that he had cut off his sandwiches, and that's why they have all these birds in the back lot of Wham! So when he starts talking about the stuff about always eating pork and all that kind of stuff, I say, yeah, right, okay. Today I come to you, though, wearing a couple hats. And the first hat is as a grunt on the front line of healthcare delivery. I've had the fortunate opportunity for the past 30 years of my life to be privileged to be able to provide care for individuals. I'm an orthopedic surgeon by trade, as Theron mentioned. But in my journey as an orthopedic surgeon, I came to meet Rob Steele. And that's why I'm here today, in support of Rob. Rob is what we need. Not only more of in medicine, but more of in Congress. And that is someone who cares more about others than he does himself. Someone who has your interests at heart, and not the heart of special interests or the power brokers in the party. I know this to be a fact because as an orthopedic surgeon, I rely on Rob as a cardiologist to help my patients both before surgery and after surgery. Rob and I have had the opportunity to take care of hundreds of patients together, and because of his efforts, we've never lost a patient. And frankly, our country is probably the sickest patient right now that Rob and I have ever come in contact with. And I truly believe by having Rob in Washington, we're going to get that patient out of the intensive care unit, and we're going to get that patient back on his feet. But we got to get him there. And one way I believe we're going to get him there is we have to let the truth known about one of the most pressing issues that our country has faced, and that is healthcare. And that's the second hat I wear, is as a healthcare policy analyst. Rob's opponent was supposedly the architect, or one of the architects, of Obamacare. For 25 years, I fought the insurance companies and HMO industry and federal government bureaucrats because my approach to healthcare reform is very similar to Rob's. And that is empowering people. Not HMOs, not insurance companies, not federal bureaucrats. Putting the finances back in the hands of people through a free market approach. John Dingell is 180 degrees away from that approach. As Theron will tell you, as Rob will tell you, I'm not a politician and I'm not a diplomat. So here's the bottom line about John Dingell. He's feeble and he's been lying to you. He cares only about himself and he doesn't give a damn about you or your family or, frankly, this country. Because if he did, he never would have signed on or been the architect for what's called Obamacare. The reason why the vast majority of physicians stand against Obamacare is because of its very premise. As opposed to empowering you, Obamacare empowers federal bureaucrats. As much as John Dingell's lied to you in our community, he was honest on one day for 1 minute. When he was asked about Obamacare, and he said, it's, quote, about controlling the people. You see, my opposition to Obamacare is based on its very premise. Its heart, its soul, its core is about the most unethical and inhumane ways of cutting healthcare costs. And that is to ration and to deny care. I've worked my entire life. I've put my life, my family's life actually, lives on the line over my opposition for that type of approach, for taking on the HMOs, insurance companies, and government bureaucrats, because our approach is about prevention and wellness and putting the finances back in the hands of the people, not the power brokers and not the multi-trillion-dollar industries. You see, one of the fallacies about Obamacare is that it really became a reality in March of 2010 when it was passed into law. The truth of the matter is Obamacare was actually two parts. The second part was the health care bill passed into law in March of 2010. But the first part was hidden in the stimulus bill. That's right. You see, Sarah Palin, love her or hate her, she was right. And she was wrong. Where she was right is that there were death panels in Obamacare. They weren't described as death panels, they were really rationing boards that will decide who gets treated and who won't get treated. But where she was wrong is they weren't in the health care bill. They were in the stimulus bill. That's right. In the stimulus bill was hidden a section about 600 pages deep, creating the Federal Coordinating Council for Comparative Effectiveness Research. It was funded for $1.1 billion, and the 15 members of the Rationing Board were to be appointed by the President. Within 3 days of the stimulus bill passing, Barack Hussein Obama appointed all 15 members, one of whom was the brother of his former Chief of Staff, Rahm Emanuel. Now, his brother happens to be a doctor. Understand something, when Rob and I became physicians, we took an oath. It was called the Hippocratic Oath. It's the same oath every physician has taken since 400 BC. And a big part of that oath is to do no harm. Well, one of my friends was in an audience where Rahm Emanuel's brother, the now appointed czar of the healthcare rationing board, was speaking. And what he said was, quote, "The problem with doctors in America is they take the Hippocratic Oath too seriously. They need to learn how to give up on their patients," end quote. Rob Steele and I have never given up on a patient. But the Obama administration, has given up on the American patient in America. That has to stop, and it stops with Rob going to Washington. Thad McCotter in a nearby district has authored a two-page bill, not 2,000, two-page bill that Rob has signed on to that he will help push through Congress when he gets there. It is called the Freedom from Rationed Healthcare Act. And what it does, that rationing board that was created, and understand something, people say, the far left, after they're done threatening to kill me, say, and I'm not kidding, say, how do you know this is a rationing board? The title, Federal Coordinating Council for Comparative Effectiveness Research. Comparative effectiveness, definition of is the cost of the treatment divided by the number of years the patient will benefit from the treatment will determine a ratio, and that ratio will be determined if you can or will be treated. It is the same ratio the British healthcare system uses. It is the same ratio that was in Hillary Care. So the very existence of this board that was hidden in the stimulus bill is evidence that rationing of care will occur with Obamacare. But it's interesting because in the healthcare bill, the second part of Obamacare, they upped the ante with this rationing board, and they created a multi-billion-dollar center to institute the decisions out of this coordinating council. There was a second board created in the stimulus bill called the National Coordinator for Health Information Technology. And in the stimulus bill it says that this national coordinator will, quote, determine treatment at the time and place of care, end quote. Now let me tell you what that means. On January 1st, 2013, when Rob and I, well, Rob won't because he'll be in Congress by then, but when I walk into a room, my nurse and my assistant will have a little handheld computer. And when I make the diagnosis on that patient, she will type it into that little handheld computer and it'll go to the National Coordinator's office. And while we are still in that room, word will come back from Washington as far as the treatment protocol that is to be instituted on that patient. It goes on under the description of this coordinator that physicians and hospitals that are, quote, not meaningful users of the system over time will face penalties, end quote. So I was asked to speak to members of Congress, and I put this to members, over 100 members of the House. What does this mean? What are the penalties? I go, are you trying to tell me that come January 1st, 2013, if a patient comes in and we send that diagnosis code and it comes back that I have to do A, B, and C, and I know A and B won't work because I've been doing this for 30 years and I'm going to do what's right for that patient and do C, that I'm going to be punished and penalized? I go, so what? And they said, yes. And I go, so are you telling me that I'll get paid $20 to see that patient, you're going to fine me $100? And they looked at me and they said, no, that's not going to make you hurt enough. Try $100,000 your first offense. I'm not kidding you. And then I said, okay, well, you know me. I'm going to do what's right for the patient, so I'm going to take care of that patient the right way as opposed to the way federal bureaucrats want me to do it. What happens the second time I do it? Because that'll probably be the next patient. And I said, are you telling me I'm going to get fined $100,000 again? And they looked at me and they said, no, Dave, you're going to go to jail. I started laughing. They didn't. There was recently a survey through the Journal of the American Medical Association, another journal through the New England Journal, and through Investors Business Daily. And it showed that 46% of all physicians are going to leave the practice of medicine when Obamacare kicks in. Let's go back to the rationing point. According to the Obama administration, 32 million more people are going to have health care. Now understand something. Just because you don't have insurance doesn't mean you don't get treated. 53% of what I do as an orthopedic surgeon is written off as bad debt and charitable care. I've yet to see anybody around Ann Arbor, Saline, anywhere in Michigan, or anywhere around the country dragging a broken leg or a broken arm because they didn't get treated. They might not have health insurance, but they got treated. Understand though, We need to make the healthcare system more available, more affordable, and more quality-oriented, something I've pushed for and Rob's pushed for decades. But there's a way to do it and a way not to do it. Dingell's way is not the way to do it. So, we're going to have 32 million more people in our healthcare system, according to Obama. And just if we keep the same number of doctors, 32 million more people in the system, same number of physicians, how do you not ration care? Add to that, now we're going to lose 46% of physicians, including me. I cannot walk into a room January 1st, 2013 and lie to the very people I've been helping for the past 30 years of my career. I won't do it. And most of my brethren won't do it. So now we got 32 million more people in the system and 46% fewer providers. How do you not ration care? Obamacare is $1.5 trillion, and the way they pay for it is with cutting Medicare by $500 billion. Okay, who's in Medicare? The elderly, right? Folks over 65, and those that are disabled. The problem is, in 10 years, we're going to have 30% more people in Medicare because of the demographics of our country. So if we're going to have 30% more people and $500 billion less to take care of them, how do you not ration care? My final point about rationing care is that President Obama nominated a physician, and I use that term loosely, by the name of Donald Berwick to run the Center for Medicare and Medicaid Services. He didn't even put him up for a Senate appointment because he knew he wouldn't get through. He put him through as a recessed appointment, so he was appointed without anyone voting for him, because I think even some Democrats would have had trouble voting for him. You see, Donald Berwick is an absolute fan and advocate of the British healthcare system and has stated, it's not if we're going to ration care, it's how soon we can do it. You know, the hardest thing I do as a physician is to tell someone they have cancer. When I get those test results, I got two options. I can take those test results and ignore them and walk in that room and essentially lie to the patient. Say, you're fine. That patient will walk out of the office with a smile on their face, but they'll be dead in a box in 6 months. I don't choose to go that route. I walk in that room and I lay it on the line. There's two responses I get when I do that. The first is anger and hostility. The first patient will get mad at me, yell and scream, and walk out the door. That patient is dead in a box in 6 months. But let me tell you what all the survivors have in common. When they're delivered the word that they have cancer, the ones that survive, look at me and go, it's really bad. I don't deserve this. Now what do we do to fix it? This is about acceptance and resolve. We need to accept that Barack Obama, Nancy Pelosi, Harry Reid, and John Dingell took this healthcare plan that will harm every person, family, and business in our country and jammed it down our throat. We have to accept that. But we have to be resolved that we are going to elect people like Rob Steele to do the job, to defund it, to repeal it, and to put an end, starting with Dingell in 2010 and ending with the removal of Barack Hussein Obama in 2012. Now it really comes down to you. We've all been too quiet, too politically correct for too long. If we want to save our country for our kids and our grandkids, so that they have the same opportunities each and every one of us has had, we need to act. No more sitting around. No more being quiet. You need to go out, and it's really hard sometimes. You need to talk to your friends and your families and anyone you can get your hands on. And you need to tell them about Rob Steele. You need to tell them what he's about and why he needs to represent all of us. Because it just isn't Rob representing this district. Rob represents our country. And trust me, I've dealt with a lot of folks in Congress. Rob Steele will turn them inside out. So do everything you can. Yeah, money helps, but money isn't everything. It's feet on the ground, and it's ears on the phone, and mouths on the phone. It's talking to your neighbors. Look, there are a lot of folks, as they mentioned, voted for Obama. This isn't about being angry or hostile to them. Okay, they were manipulated. It's your role to educate them, to bring the light of truth, and not the misrepresentations and lies of Dingle to the forefront. It comes down to you. Thank you.